Hi, it's Craig Smith, and I want to take a minute to answer a question from a client. The question is, what are the costs of Medicare Part B? In 2023, Medicare Part B has a monthly premium of $164.90 or higher depending on your income. Now, the amount can change each year. You'll pay the premium each month even if you don't get any Part B covered services. Now, you may pay a monthly penalty if you don't sign up for Part B when you're first eligible for Medicare, usually when you turn 65. And you'll pay the penalty for as long as you have Part B. Now, the penalty goes up the longer you wait to sign up. Now, Part B has a deductible of $226 before original Medicare starts to pay. Now, you pay this deductible once each year. With Part B, there are general costs referred to as coinsurance, usually 20% of the cost for each Medicare covered service or item after you've paid your deductible, as long as your doctor or healthcare provider accepts Medicare approved amount as full payment, which is called the assigned amount. Now, the cost is zero for covered clinical services, the cost is zero for covered home healthcare services, and 20% of the Medicare approved amount for durable medical equipment like wheelchairs, walkers, hospital beds, and other types of equipment. Now, the cost for inpatient hospital care is 20% of the Medicare approved amount for most doctor services. Now, you'll usually pay 20% of the Medicare approved amount for doctor and healthcare provider services. You'll also pay a copayment to the hospital for each service you get in a hospital as an outpatient setting, except for certain preventative services. Now, in most cases, your copayment won't be more than the Part A hospital stay deductible amount, but there are other costs you may incur as well, so it's important to make sure that you have all the right coverage in place.